Okay, moving on down to oral care. This is one of the things a lot of times we notice at the center. People will come in and we start noticing some bad breath. And we'll say to the family members, are they brushing their teeth? Oh yeah, they go into the bathroom and they take their shower and they do this and they do that. And, well, they might not be brushing their teeth, so you need to check to make sure. They might, and even if it's laid out for them, you know, usually in the disease process, in the beginning, just laying out, they'll see it, oh, I gotta brush my teeth. But it gets to that point where they just look at it, and again, they're not making the connection that, oh, there's my toothbrush, there's a toothpaste, I need to brush my teeth. They look in the mirror, they, I don't know, fiddle with the toilet paper, whatever they do in there, but they come out, what's that?
They forgot to.
They forget, or they just forget why they went in there. So again, it's and it's not always easy because now not only are you having to brush your own teeth, but you now need to think about helping brush the other person's teeth. What I encourage you to do is when you go in to do some of that stuff, bring them with you. So you do it together. Because sometimes all they need to see is that you're doing it, you hand them their toothbrush, and then they start doing it themselves. So being in there with them, then you know that their teeth are brushed. Another issue, false teeth. A lot of our folks have false teeth. As the disease progresses, they're not taking the teeth out. We start to have odors from that, or you see them fiddling with their teeth because there's stuff underneath them. They'll tell you that they washed their teeth, but they probably didn't. Weight loss. Weight loss comes along with this disease process, so the dentures don't fit that good anymore. And what we see a lot at the center is when it's lunchtime, they take their teeth out and put them in their little napkin or lay them on the table next to their plate so that they can eat because they're not comfortable for them anymore. So again, making sure that they're getting them out. The dentist, if you don't have them, if you don't know how to do it, the dentist can show you how to help them get them out of their mouth. Because some of them, you have forgotten that they do come out of their mouth. But they need to be clean because I've seen infections underneath there. I've seen other issues that you don't even want to talk about because the teeth have not come out in a very, very long time. The other issue if you're noticing bad breath and you know that they are brushing their teeth because you're doing it for them or you're cleaning their dentures so you know that it's clean, but there's still some bad breath going on, that is the #1 sign when somebody becomes impacted. And their breath just has this horrible, horrible odor about it. And some of the unfortunate issues that happen as the disease progresses is people become incontinent, and I'll explain how this all happens because it didn't make sense to me why someone could just hold going to the bathroom. And get to the point where now they're impacted and it's affecting their entire body system. So another sign of this bad breath is that someone could be impacted, meaning that they haven't gone to the bathroom in a week or more, or who knows how long it's been. So we'll talk about that when we get down a little bit further. Move on down for the men. Your wives, they're used to cleaning and dressing and putting bras on and all those kinds of things. One of the things that happens with women as we get a little bit older, everything kind of falls down, sags a little bit, and it does. It's just the laws of nature. And for some women, especially later in the disease, trying to get a bra on them is impossible. I mean, so a lot of people give up, and that's absolutely fine. But you need to be checking to make sure that under their breasts, that if now kind of sagging down, that we don't have infections going on under there. Yeast loves to grow in that area. And it doesn't hurt necessarily, and sometimes even if it does hurt, they don't say anything. But occasionally, we've found someone and they just have this raging yeast infection, and it just needs to be cleaned and treated. Now, don't treat it with lotions because yeast likes dry, moist places. Usually if you're going to clean it under there and dry it, so that it's nice and dry. Sometimes a little powder, but not a lot of powder, because the powder can build up too and cause infections under there. Yes, Mary
You can
Ann.
even use cornstarch.
Cornstarch,
It
yeah.
works really well. That's something that's probably in your kitchen.
Yeah, for most people, that's in the kitchen
I
cabinet.
use
Grace?
my hair blow dryer and I squeeze the thing so
To dry it off.
To make sure he's dry.
Yeah, exactly.
Yeah.
And men can get these yeast infections too, armpits, groin, and again, you know, you might see him scratching or something and you look and it's like, oh my goodness, how did this happen? And it happens so quickly. That's the other key, it can happen so quickly. So men, if you are, you know, at that point where you're having to take care of your wife's needs, just check to make sure we don't have any infections going on under there. And also, another thing that's in the bathroom that maybe they don't use anymore is their deodorant. You know, we can usually tell where somebody's at in the disease process as they're coming to the center, and, you know, they have bad breath, they have a little bit of body odor going on, and, you know, if you went to the house and looked in the bathroom, the towel's still dry, the tub is still dry, the deodorant hasn't been opened in a month, the toothpaste is still full because none of these things are happening. They're just in there rattling around. If you're noticing the odors, or we will say to our families, you know, we think, you know, what's going on in that bathroom? Maybe you need to go in and see what they're doing in there. And I know there's some people, some women who have had breast cancer who don't use deodorants anymore, but there's something that they were doing to keep themselves from not having a body odor. So making sure that, you know, like a friend of mine had her breast removed, she cannot use deodorants, and she uses alcohol under her armpits, and she never has an odor. And so, but that works for her. So just knowing if there's an odd issue that, you know, your loved one is having, that you might need to continue to follow that also.
Can they use that as well? Under the alcohol?
I'm not an advocate for alcohol because it's very drying,
Yeah.
but for her it seems to work. So I would say, yes, I mean, alcohol isn't harmful, but it's very drying. If there's I would say more like witch hazel would be a better alternative in my opinion, but I know this particular person just, that's what she uses. If I were using alcohol, I would make sure that there's no, like if someone had just shaved the armpit or something, that you're not putting it on there and burning it, or that you just look and make sure that there's not any breakdown going on, so.
He has a bad odor, and no matter what we do, it's always there.
Is it?
You know, taking zinc is very good for that too, for body odors.
Taking zinc is good for body odors. This is the great thing about this. People sharing some of the things that work for some and don't work for others, or so zinc is, you haven't noticed any redness or white stuff under there? Has he always had that?
For a couple of years. I know it was a medication.
Well, that was the next thing I was going to say. Sometimes medication can cause different body odors and issues that you really can't control. So everyone has different sensitivities.